we begin with the turmoil at the top of the Centers for Disease Control and Prevention. The US agency, seen by many as the world's gold standard in public health, is without a director and other top officials. The White House fired Director Susan Monarez less than a month after she was sworn in. A close associate says she was ousted after refusing to sign off on changes to vaccines put forward by Health Secretary Robert F. Kennedy Jr. The White House says a replacement will be named soon. Well, it began with a back and forth about whether Dr. Monarez still had a job. On Wednesday, the Department of Health and Human Services said she was no longer director. Her lawyers then issued a statement saying she had neither resigned nor been fired, and it added, when CDC Director Susan Monarez refused to rubber stamp unscientific, reckless directives and fire dedicated health experts, she chose protecting the public over serving a political agenda. For that reason, she has been targeted. Well, the White House later confirmed that Dr. Monarez had been fired. A spokesman at Kesh Desai said, as her attorney's statement makes abundantly clear, Susan Monarez is not aligned with the president's agenda of making America healthy again. Well, after the director was fired, other senior officials announced their resignations, including the CDC's chief medical officer and the director of its infectious disease center. They also cited vaccine policy and political interference. The changes at the top of the CDC come as Health Secretary Robert F. Kennedy Jr. makes sweeping changes to vaccine policies. Earlier, he dismissed the CDC's vaccine advisory panel and replaced it with fellow anti-vaccine activists and hand-picked advisors. On Wednesday, he announced changes limiting access to new COVID vaccines. In an interview on Fox News' Fox and Friends, Mr. Kennedy said the CDC must enact President Trump's agenda.
The agency is in trouble and we need to fix it, and we are fixing it, and it may be that some people should not be working there anymore. And we need strong leadership that will go in there and that will be able to execute on President Trump's broad ambitions.
Eric Feigl-Ding is an epidemiologist and chair of the Department of Public Health at the New England Complex Systems Institute. He joins us from Washington, D.C. Welcome back to DW, Doctor. This sounds like the sort of messy infighting that organisations would prefer happen behind closed doors. What's your reading of what's going on at the CDC right now?
Thanks for having me. I think what's happening in the CDC is the culmination of the spillover of all the other things that basically the CDC director did not want to do. And now this was the last straw. And she basically has somehow crossed the line with RFK Jr. and Donald Trump, because there's been many things like pulling the CDC vaccine advisory committee, eliminating all of them, as well as, other vaccine guidelines, eliminating vaccine availability to children, eliminating vaccine availability to those under 65 unless you have high risk, and many other things such as prevention task forces at the CDC and setting guidances without any CDC consultation. So I think this is more like many, many layers in, and that's what's led to the CDC director being fired. Forced out, as well as a slew of 4 other senior scientists, including chief medical officer and the head of the immunization division, all immediately resigning after she was forced out. So this is basically putting politics above public health. And those who are scientists at the CDC on the inside just could not stand it anymore, right, and probably had a big infight, and this is what's led to this.
And so what do you think the Health Secretary, Robert F. Kennedy, is trying to achieve?
Well, he's trying to do a wholesale elimination of anyone who is, believer in science, someone who follows science, because unless you follow exactly what kisses butt and a rear end and does exactly what he wants. Remember, RFK Jr. is the anti-vax king. He led the largest anti-vaccine group for many decades. So unless you do exactly what he says, you're being forced out. And he's systematically trying to eliminate vaccines of every type, not just COVID vaccines, from the national guidance and packing these vaccine committees with his basically goons and anti-vax lunatics, to be honest. And I think this is where his agenda ultimately is colliding with the scientific basis and expertise of the CDC. And he is not tolerating insubordination. And now here we are, science versus anti-vax.
And does he get to just do as he likes, or are there supposed to be checks and balances?
Well, the checks and balances supposedly was his Senate confirmation. Clearly, everything he said, promising the Republican senator, who's actually a doctor, that he won't, follow anti-science quackery. And clearly, he's not keeping up with any of his promises. The checks and balances normally, with a CDC director, can't be fired by RFK Jr., health secretary. He can only be fired by Trump. So last night, when her lawyer protested, then escalated to Donald Trump. And it was actually Donald Trump in the end who fired her, the CDC director, last night. So I think she's very courageous, and many other people in the CDC leadership have been incredibly courageous around speaking up. And I think there is a line in which you just can't be a yes person. You can't just be someone who checks off the box of whatever the political leadership says. You have to follow the science. And this is their way of protesting and fighting back.
One of the things you mentioned in your list of things that Mr. Kennedy wants to achieve and has done already is limiting access to COVID-19 vaccines. Talk us through the significance of that decision.
Yeah, so COVID vaccine, they eliminated emergency authorizations, which means now they will only allow it with full approval. And for full approval, basically, they only allowed it for adults. Children can't have vaccines. But actually, we're in this a pickle because although the FDA has approved it, in order for the updated fall COVID boosters to be available to every American, it still needs to be signed off by the CDC director and as well as the vaccine committee. The vaccine committee is, of course, as I mentioned earlier, stacked with RFK Jr.'s new committee of anti-vaxxers and vaccine skeptics. And we don't have a CDC director to sign off on the new vaccine. So there is rumors that basically they want to eliminate all of the vaccine availability or make it extremely difficult to access to a degree that, because the CDC can technically override whatever the FDA approved and recommended. The FDA is not the final word on the vaccines, the CDC is. And I think they're trying to do a wholesale elimination of these vaccine availability, or at least squeeze it to such a narrow availability that it won't be available to most of the general public, even as COVID hospital ER visits have surged to almost winter peak of last winter.
I didn't know that.
And yet no one's talking about this at all.
You brought me to my next point, which is really these decisions clearly are likely to have and are having real-world consequences.
Mm-hmm. Exactly. Because right now the CDC is rudderless, is leadershipless, and cannot actually sign off on anything, because a CDC director in the past did not need Senate approval, but starting this Trump administration, according to the latest laws, it requires Senate confirmation. Now, we don't have a CDC director. We might have an acting director, but an acting director is going to be probably an RFK Jr. appointed, anti-vaxxer leader. And right now we don't actually have. So the chyron that says FDA approves it, that doesn't mean it's going to be available. The CDC has to sign off on it. And I think that is where the battle was. She wanted to do it. He did not. And many other scientists have been fighting against the anti-vaxxers on the vaccine committee. And I think it's definitely that's what came to a head. And I think this is just the tip of the iceberg of what's to come. They're trying to eliminate school vaccine requirements for attending schools. And we have now the American Academy of Pediatrics fighting against the CDC's on so many vaccine guidance that they've now diluted down. So we're in this terrible era in which we can't trust the CDC, public health scientists. The science is not where the CDC is now. The science, many people are looking to other countries, European medical association, Canadian organization, medical societies like American Academy of Pediatrics. They are where the science is, not the CDC. And that's a very, very sad day in America.
Okay, thanks for that, Doctor. Dr. Eric Feigl-Ding, epidemiologist and chair of the Department of Public Health at the New England Complex Systems Institute. Thank you.